Happy Friday, Baylor College of Medicine and friends of Baylor. Well, I had promised you I was going to talk about the reorganization of the Health and Human Services, but I'm not doing that today. The reason is because new data came in about COVID. Remember, I mentioned last week that we hadn't had any updates on the variants that were in the United States other than what the Travelers Program is. Well, we have data, and I think it's the most important stuff to look at this week. In addition to that, I've been waiting for that late summer surge for COVID all summer, and it sort of didn't come. Well, it's now coming. So COVID is really getting to be a real problem in the early fall. So you can see it continues to go up. Early indicators, test positivity continues to rise. Emergency department visits are increasing, and now hospitalizations, a lagging indicator, are also increasing. So we're beginning to see a pretty big surge in COVID. This is another week of travelers data showing that it's continuing to increase. And I showed you this last week that the dominant strain was XFG, that's commonly known as Stratus. XFG last week was 50% of the variants coming in from airports and airplanes. Just a mere 2 weeks later, XFG is now 62%, and you can see the dominant strain this past year in the United States, LP8.1, is virtually not there. And then this I showed you last week, which was the data on variants in the United States from June 21st. And you can see it's pretty evenly distributed, with LPA about 31% and NB 1.81, 43%. XFG was only 14% in the beginning of the summer. And I had showed you, and this I'm going to remind you because it's really important to look at this week's data. It looked like in the beginning of the summer there was a battle between these two Omicron variants. The ones that were sort of going up here that were derivatives of the last year's flirt variants, LP8.1, and then this new recombinant that was initially called Nimbus and then had a mutation and became Stratus, this line down here. And it looked like early on that they were battling, but I had said last week I thought XFG probably would dominate. Well, the data came out. And in the old saying, even a blind pig finds an acorn, that time I was right. So it looks like XFG is really dominating. It's on like 78%. The Stratus now, and NB 1.81 is actually very, very, is only 14%. LP8 is almost nothing, 3%. So again, the recommendation just a couple of months ago for the vaccine this fall was LP8, but I hope that the manufacturers will do XFG. Why then, my sister asked, there's so much around, very good question, why isn't everybody just sick all the time and why have a huge mortality? And the reason is that we do have, as a nation, a significant amount of resistance, either seroprevalence from infections for people who didn't get vaccinated or people who've been vaccinated and or infected. And you can see the purple represents around 60% of the population. So the seroprevalence in the United States is almost 60%. What's interesting is if you look at the number of cases that were present in early 2022, it's 78 million. We now anticipate, or it looks like there's been at least almost 200 million cases, 186 million cases of COVID. And so there's a lot of resistance that's just sort of natural from having been infected or vaccinated. That said, resistance wanes, the virus keeps changing, and so that's why people are susceptible to being reinfected, but because they have some resistance, it's not like it was initially when no one was resistant, and everyone had their first exposure, and there was a lot of mortality. Of course, it doesn't explain why the Florida Surgeon General just said that they're no longer requiring vaccines to attend school, but makes no sense. In Texas, you can see we're seeing a surge. So this past week, there were 7,000 probable and confirmed cases, up from 5,000 before. And not surprising, the population centers are where most of the cases are happening. So our own Harris County probably leads the way, but also Bexar County. There is Lakeland Air Force Base there, probably related. and Tarrant County, which is where Fort Worth is, the third most populous county. Harris being the most populous, Tarrant County the third most populous. So where there's a urbanization, collection of people, you'll see more and more infection. What is surprising to me is, I mentioned this, we were waiting for the summer surge. This is COVID in Texas each of the last 5 years. And you can see there was this pretty predictable surge that happened in June, July, and August. This year, in green here, you can see it's just beginning to surge. So it's a later than anticipated. I had anticipated we'd see something sooner, but my guess is it's going to be late but very, very intense. So we're going to see a lot of infections, especially in schools. All the more reason why you want to get kids vaccinated, unless you're in the state of Florida. Anyway, is that just happening in the U.S.? No. Cases are surging worldwide. This is WHO data. You can see a huge number of cases in South America, mostly in Brazil, and Europe has had a ton. You remember I mentioned that the recombinant variant that was originally Stratus came through China and Europe, and so Romania is high, Greece, and the UK. So I was sort of right but late on COVID. I was completely wrong on West Nile. Now this is the middle. The reason I want to talk about it, this is the time when West Nile should be surging. And we were particularly worried about the flooding in the hill country, that there are a lot of standing water. There might be a lot of cases of West Nile. But it's not quite as bad as I anticipated. Anyway, let's talk a little bit about West Nile. It is the most common mosquito-borne disease. Most people, 80% of the people who get bitten by an infected mosquito and get infected have no symptoms at all. 20% develop symptoms that usually start 2 to 6 days after you've been bitten. And they're usually like symptoms typical of any kind of viral illness: fever, headache, body aches, usually GI complaints, sometimes a rash. In about 1/3 of the patients that develop symptoms, there can be very serious neuroinvasive disease, the worst of which could be an encephalitis that can lead to hospitalization and death. So it's a pretty serious illness when you have a neuroinvasive disease. There are no licensed vaccines against this, and there is no medication currently other than symptomatic medication. Now, for those of you who are interested, West Nile is a flavivirus that is transmitted, as I said, by mosquitoes. It is the most frequent cause of insect-borne disease in the United States and is the most widely distributed arbovirus in the world. First case was detected in the United States in New York City, of course, in 1999, and it has really spread throughout the Western Hemisphere since then. It's now can be seen in Canada all the way down to the southern tip of Argentina. Transmission is always mosquito-related. It's usually in the late summer and fall. 94% of the cases happen in a very small window, July, August, and September, because it's the cycle of the Culex mosquitoes. It is maintained in the life cycle by the Culex mosquitoes' interest in birds. So it really is a zoonosis that is mosquito to birds and then transmitted between these mosquitoes and birds. And you'll see some birds that are very susceptible. Crows and jays are known to get sick, and they're often the birds that you'll see dead around. Don't pick them up. But there are certain birds that are kind of resistant and amplify the virus. Robins are known to be one of those bird species. But West Nile can infect many, many different bird species, and that's the life cycle. We're not the intended target. If there's a female mosquito that happens to be hungry and it's normally looking for a bird and it finds you, that's how you get infected. So obviously the prevention is really focused around preventing mosquito bites. But I thought this was going to be a really bad year. That was my prediction. And once again, I was incorrect. So these are the yearly cases since 1999, when it was first case in the United States. And you can see it really started peaking in 2003 was the highest number of cases, big surge in 2012, and last year was 1,791. This year, we're at 433. So, and the season's almost over. So I don't think we're going to hit that number. I was all fired up about West Nile and nothing happened. About half of the cases, remember I said 1/3 of the symptomatic cases develop more invasive disease. In this number, this year it's running about half. So 257 of 433 have had neuroinvasive disease. And it's pretty prevalent. It's all over the states. You can see these are all the states that are reporting it. And this is an amazing thing. It shows you how clearly it is locked into the mosquito life cycle. These are the months over the last many, many years, the months where most of the cases happen. And you can see it starts in July, peaks in August, and by the end of September it's gone, as are the mosquitoes. Anyway, lots of new data today around COVID, so I really wanted to mention that. Frankly, if you have not, because it's surging, if you have not been vaccinated or had the disease within the last 6 months, I would strongly recommend you get a booster, because it's just beginning now. When you think about your flu season's a little bit later, October, November, December, usually the best time to get a flu shot's October, so your immunity 6 weeks later, you're all set in November, December, and January. But COVID's around and surging now, so anybody over 65 who hasn't been recently vaccinated, I would get a booster. I was vaccinated. I think I mentioned I was going to Singapore in June, and there was a surge in Singapore, so I got a booster in June. I'm going to wait for 5 or 6 months, and then I'll get my, hopefully, the booster that is targeted to XFG, but we never know. I want to end today with a bunch of shout-outs. First of all, congratulations to the 12 Baylor College of Medicine alumni and faculty who are being honored by our Alumni Association for their career accomplishments. 2 of these are Matthew Wall, class of 84, and Stuart Udofsky, class of 70. They will receive the prestigious Lifetime Achievement Award. Dr. Wall is a professor of surgery at Baylor, where he made several groundbreaking contributions to the field of trauma and cardiothoracic surgery. Dr. Stuart Udofsky is a distinguished professor emeritus who served as chair of the Baylor Department of Psychiatry for almost 25 years and had a big role in recruiting me. So, big shout out to Stuart. Also, Baylor recently received nearly $15 million from the National Institute of Environmental Health Sciences to renew the Baylor Rice Superfund Research Program. This is a 5-year grant that allows researchers to investigate how maternal exposure to polycyclic aromatic hydrocarbons from Superfund sites contributes to preterm births and neonatal chronic lung disease. So this is a great program that integrates environmental science and sort of general biomedical research and genetics. It's a really great idea to look at remediation strategies. Really great science. Congratulations to Dr. Moorthy, Professor of Pediatrics, is the PI and the Program Director of the Baylor Rice SRP Center. And finally, a shout out to Dr. Kathy Barsness, Professor and Vice Chair of General Surgery and Chair of Pediatric Surgery at Christus Children's Hospital in San Antonio, has been elected President for the International Pediatric Endosurgery Group, which is an international organization that looks at surgeons who use minimally invasive techniques in children. So anyway, I hope you have a wonderful weekend, and I can't wait to see you next week.